Here we go.
Good evening, everyone, and welcome to another webinar hosted by the Greenwich Hospital Medical Library. My name is Veronica Belenkin, and I'm the Consumer Health Librarian at Greenwich Hospital. Tonight's webinar is an update on the COVID-19 vaccines, and for myself and others, I'm sure it is hard to put into words how far we've come since the COVID-19 pandemic started and to appreciate how far we've come. So I decided to start this webinar with a picture and headline from just 5 months ago. For those of you who may not be familiar with who this is or do not recall, this is Sandra Lindsay, a ICU nurse in Queens who was among the first healthcare workers as well as the first American citizen to be vaccinated with the COVID-19 vaccine back in December of 2020. That picture shows that she's getting the first dose of the Pfizer vaccine, one of the first vaccines to be authorized for emergency use by the FDA. And what has become a historic moment has been put into this picture. And what really struck me about this is that she did this not only, because it's been the first glimmer of hope in the whole year of the pandemic. It was also her way to persuade skeptics of the vaccine, of the newly distributed vaccine, to still get it and lower the cases, hospitalizations, and deaths in the United States as a result. And I'm really happy to say that as we fast forward to today, that has really been the case in a lot of the states in the United States. Cases are down, hospitalizations are down, deaths are down. I was informed just 2 hours ago that in Greenwich itself, there have been virtually 0 cases, except for one in the hospital. So I wanted to do this update because despite all of this great news, there is still a virality of misinformation that appears on the internet when people search for help for the COVID-19 vaccine information. And I hope that viewers tonight can come away knowing some more reliable and accurate resources to refer to for more accurate information on those vaccines, as well as how to spot and stop the spread of misinformation on the vaccines when you see it online. And I'm also very fortunate tonight to be joined by Doctors Gavin McLeod and Ralph Cipriani, who are 2 local infectious disease specialists here in Greenwich. Thank you so much for joining us tonight. And I hope that you are both aware how important your work has been over the last year and will continue to be. So thank you so much.
Thank you. You're welcome. Thanks.
And somber as that introduction was, we will continue with better spirits. I always start my webinars with a disclaimer that this presentation is for educational and informational purposes only. Please always consult your doctor or other healthcare provider for medical advice before making any lifestyle decisions that may impact your health. And all images that are used in this webinar are sourced from reliable health websites or are under the Creative Commons Digital's license, which means they are free to use. So the general overview of this webinar tonight will be starting with introductions of myself and the doctors who are my guest experts, because I believe in being transparent with who is speaking tonight. We're also going to be going over the current status of COVID-19 vaccination in the US and state of Connecticut, just a general overview of what vaccines regarding COVID-19 are. And I will be providing some examples that you might be familiar with of what vaccine misinformation might look like online, some reliable resources for COVID-19 vaccination information, and we will be hopefully ending half an hour with primarily with questions for our guest experts, either from the audience or from myself as well. So I'll start with myself. My name is Veronica Belenkin, and if you are not familiar with what a consumer health librarian does, I find, share, and evaluate health information for anyone that requests it, be it patient, visitor, or medical staff. And I received my master's in library science from Queens College, and I started this job in 2018. And I spend most of my job, including these webinars, hoping to promote health and online literacy, promote health and prevention, wellness education, and to help better advocate for the patient's ability to be more informed and educated about their healthcare needs. Next, we have an intro for Dr. McLeod. Dr. McLeod, would you like to just briefly introduce yourself to our viewers who may not be familiar with you?
Doctor, you're muted.
Okay, as Veronica said, I'm the infectious disease physician, director of infectious disease at Greenwich Hospital. I also am an associate clinical professor at Columbia. I've been involved with a prior pandemic, the HIV, which when I was going into medical school and residency was just starting and was a big concern then. But of course, it's been nothing compared to the COVID pandemic. And this has changed, I think, as we know, our lives outside the hospital, but in the hospital, it was also quite a change what happened. We had a peak in March of last year when we're getting like 20 to 25 patients admitted a day. And I think we were up to 120 at that time. And we were getting patients not just from Greenwich, but from New York City patients were coming up. So it was quite a change. And when the vaccines became available at the end of 2020, and to see what's happened over the last 6 months has been amazing. I don't think we see individuals now come into the hospital with COVID unless they have not gotten the vaccine. There's one case I remember of a woman who did have the vaccine and came in, but she wasn't that sick. And I think that's what's been shown with the vaccines, that they're so efficacious and have reduced the numbers. So I think we'll go through the vaccines with Veronica's slides, and we'll talk more, and I'll be open to answer questions later.
Yep, thank you, Dr. McLeod. And that actually reminds me, for anyone in the audience who does have questions, please save them for the question portion, which will be taking up most of the last half hour of the webinar. So I really appreciate if you just be patient and wait to ask questions. But thank you, Dr. McLeod. I myself was in the hospital during the height of it, and I know how intense it was, particularly for the infection prevention unit and ICU and emergency units. So it's hard to know what it's like unless you were there. So, and next we have Dr. Cipriani. And what's a fun fact about him is that he primarily worked at Greenwich, formerly worked at Greenwich Hospital before. So tell us a little bit about yourself, Dr.
Sure. So I practiced exclusively infectious diseases in Greenwich Hospital, similar to what Dr. McLeod has been doing for several years now. I practiced at Greenwich from 2002 through 2012, exclusively infectious diseases. And from 2012 to 2018, I had elected to practice internal medicine, again, general internal medicine, but I also did practice mostly outpatient, some inpatient infectious diseases at Stanford Hospital. And in 2018, I returned to the Greenwich area, mainly practicing internal medicine at Glenville Medical Group. And I do practice some outpatient infectious diseases. I do practice some infectious diseases as an outpatient, but nothing like the intensity of Dr. McLeod as with inpatient cases.
Well, I'm sure you've been encountering a lot of
We've been encountering, yes, as in our office, we had a very busy year with COVID, and we gained a lot of insight during this past year. It's been an amazing year.
Yeah, I'm sure you've been getting a lot of questions about the vaccines as being a specialist, but yeah, if there are any tonight that would like to ask, you are certainly as qualified to provide that kind of information. So thank you so much. With that, we shall continue with just providing a contextual basis of the vaccinations in the US. And again, I am using a picture to illustrate this because pictures are worth 1,000 words. The words on here specifically are from the New York Times headline saying that COVID cases and deaths in the United States dropped to lowest levels in nearly a year. And this, I saw this on my Facebook about a week ago, I believe, and I was not, I could not have been happier to read that considering everything that's occurred. So I received this headline from the coronavirus outbreak section of the New York Times, which has been very informative. I highly recommend this as a resource for people to look at. While other articles you may need to subscribe and pay a fee for, the coronavirus outbreak section of the New York Times, all you have to do is just make an account and you're open to everything on it, including updates, including the tracker that's on it that are statewide, and all of the information about the vaccines are available to you just by making an account. It's completely free. And on that website, you'll see that 51% of Americans total have received at least one vaccine dose, and that experts anticipate that herd immunity can be achieved in the United States. It's 70 to 90% of the total population acquires resistance. And I'm assuming that resistance primarily means vaccination, but it can also refer to just if you had the virus as well. Could either of you comment on herd immunity and maybe briefly explain what that means to those of us who may not know? Either one of you can chime in.
Sure. Herd immunity or vaccine immunity generally refers to the fact that as more and more of the population is vaccinated, the prevalence of disease decreases considerably. Therefore, if there's less virus circulating in the population, there's less virus to infect others. So you get the herd immunity effect, as we call it.
Do you have anything to add to that, Dr. McLeod?
Yeah, so I would just add that, it's not just, as you alluded, the vaccine itself, but if some patients have had the infection, they could be immune. What's interesting, though, is the vaccine seems to provide better immunity and longer lasting than the natural infection. I think we do see the patients who are the sickest make the highest antibody levels, although antibody is not the only way to measure immunity. There's what's called cell-mediated immunity. But it's clear that the vaccine is the best way to have the highest level of protection. So I think, the ideal goal, and I know President Biden has been saying this, he wants to get 70% of adults vaccinated by July 4th, and that's sort of that number. I heard the CDC director saying that once we get to 70, she'd like to get to 80 on top of it. And I think that's all our goal in infectious disease, because I think we have seen just in Connecticut here, because I think we're over 70% first dose vaccinated in adults. So I think that's one reason in Connecticut the numbers have dropped so dramatically.
And I'll add one other point, that the data is not out yet, but preliminarily it does seem that the vaccine does prevent or certainly lessen the transmissibility of virus in vaccinees, even if they're without symptoms. And we all well know that during the heights of the pandemic, that people who would, even without symptoms in non-vaccinated people, they certainly are reservoirs of virus and extremely transmissible in many cases. So that's part of how herd immunity functions.
All right, thank you for clarifying. And the 70 to 90%, is that just that range? It's not just an arbitrary number. That's specifically the range that is recognized as what the population needs, correct?
Correct.
Okay, so I was just wondering because that range was very wide, but
yeah, 90 is probably quite a bit, but I would say around 70 or so is more realistic.
And then the last, I think, important percentage was that the positive COVID tests have fallen below 3%, which again, we can attribute to vaccines creating a lot of antibodies, making it less transmissible overall. So compared to last year, this is just such a relief to read. So I thought I would share. So particularly in Connecticut and even more locally, Greenwich itself, there was this the data and map provided by the Connecticut Department of Public Health As you can see, the percentages that are dark green are the ones that are with the highest vaccination of first doses. But there are still some in the area in the dark blue and bluish range that are still just around 50 to 60%. So not everywhere is completely totally vaccinated, not even starting with the first dose, but we're getting there. And what Dr. McLeod was saying, this article from the Hartford Courant from April, they specifically were trying to reach out to those who were not vaccinated yet, because it is true what this is being said, that those who are hospitalized in Connecticut are those who are exclusively unvaccinated. And clearly, based on what Dr. McLeod said, it is still the case that those that are hospitalized are most likely unvaccinated. But luckily, in the state of Connecticut itself, 54% of the population are, as of now, fully vaccinated. So we're on our way to that 70% threshold. However, in Fairfield County as a whole, there is still a high COVID-19 transmission rate, which means that unvaccinated people in this county have a high risk of becoming affected and hospitalized. An average of 3 cases per day, which is a lot less than before. But still, and this is the statistic I received from the New York Times coronavirus information site, which is having trouble loading, but they do explain that the reason that they label it high risk is because there is an average of 3 cases or more within the last 2 weeks. Correct me if I'm wrong, doctors, but that is how it was described to me in the New York Times coronavirus outbreak thing. And I wish it would load, but unfortunately it does not. And then from another reliable source that I've been using to update myself, it's from the Connecticut Department of Public Health. It outlines to us that the lowest percentage of fully vaccinated individuals are between 12 to 15 years old. And the highest percentage of fully vaccinated individuals are over the age of 65. Now, those statistics seem vast, and there's a large gap, but it makes sense when you remember that the elderly over the age of 65 were among the first eligible to take the vaccine in the state of Connecticut. And it was only recently that 12 to 15 years old were eligible. So I would highly encourage people to visit the Connecticut Department of Health, as well as the Connecticut.gov vaccine portal for the latest state guidance and updates on COVID-19. And I'll just briefly show you what the vaccine portal looks like. So this is what it looks like when you go on the site. They have you already, for anybody who is still struggling to find an appointment, they will be able to provide you with a provider nearby. There is even some initiatives that were launched in Connecticut to encourage you to get the vaccine. That's worthy of being checked out. And then just a bunch of options ranging from vaccine safety facts to data tracker to even information for homebound individuals. The state of Connecticut can provide certain individuals who are homebound with transportation to vaccine clinics in case there are some who cannot get there on their own. Now we have just a general overview of what's going on with COVID-19 vaccines. As I stated earlier, there are 3 COVID-19 vaccines currently authorized and recommended for use in the United States. Those are the Pfizer, the Moderna, and the Johnson & Johnson, aka Janssen. And the latest guidance as of May 12th have been that the Pfizer is the only FDA emergency use authorized vaccine for children ages 12 to 17. And I've been seeing a lot of headlines saying that Moderna may be next, and it is currently applying for that same emergency use authorization for that age group, as it is shown that its clinical trials are 100% effective on that age group. I would recommend people check out this link if they're still confused as to what emergency use authorization actually means. I would definitely check out this link. And I was told by the doctors Cipriani and McLeod that when I say the term fully vaccinated throughout this webinar, that is to mean that is anyone who is 2 weeks after their final dose, whether it be for Pfizer or Moderna. Does this apply, doctors, does this apply also to Johnson & Johnson? Do people need to wait 2 weeks after that, or is that fine once they get that dose?
That's accurate. You're accurate.
They still have to wait 2 weeks?
Yes, after that one
Even
dose,
for Johnson?
there's a 2-week
Okay.
hiatus, yes.
And so the 2 links that I will give you to learn more about the different vaccines for COVID-19 and how they work. The CDC has a great website that specifies, that goes into specifics about each vaccine. So you have all these options right here, Pfizer, Moderna, and Johnson. You just click on one of them. It'll tell you general information. It provides a list of full ingredients for those who are interested in going down to the very minute detail, talking about possible side effects, specific guidance on who should not be get vaccinated, safe data summary, and all the specifics. They even have a fact sheet for recipients and caregivers, and also any sort of advisory that comes along with these vaccines, including any allergic reactions and any kind of adverse events that have occurred. And then last but not least, we have the COVID-19 vaccine tracker that is still part of that New York Times coronavirus outbreak section that I showed earlier. Let's see if this one will open up online. Oh, okay, looks a lot better already. So as you can see right here, this particular section goes into a lot more detail on how they were approved, because each vaccine had to go through 3 phases in order to be approved. And a lot of vaccines have applied and been through these trials. So not only do they go into detail about these phases, they go over the various types, such as the genetic vaccines, the ones that had the mRNA, just a ton of detail that's really easy to read and very accessible. So I highly recommend that resource as well. So the next few slides will just be specifics on the vaccines, and I'm going to leave this up to Dr. Cipriani or Dr. McLeod. Please chime in and maybe explain to us just briefly about each vaccine, and just let me know when to move on to the next slide. The first one is the Moderna vaccine. So for instance, we can start off with what exactly is mRNA, for instance.
Well, mRNA stands for messenger ribonucleic acid. It's not DNA, it's the RNA, and our cells use RNA. This technology was used for the Ebola vaccine, and it is a technology that's been studied for 10 or 20 years. Working with an RNA, there's a chemist and biologist at University of Berkeley who won the Nobel Prize in Medicine last year for research on RNA technology. It's doesn't go into our cells. People always worry about RNA going into the nucleus of the cell and affecting the DNA. It's actually short-lived. It stays in the cytoplasm, and all it does is produce the spike protein. So it's not infectious. It's not actual virus. It's the outer coating of the spike that our cells are making, and it's only temporarily. The mRNA is then degraded by our cells. The hardest thing in developing these mRNA vaccines was making it so the mRNA could get into the cytoplasma, but they did that with a lipid biolayer. And that lipid biolayer is the one that has to be kept frozen. That's why it can't be kept in a regular fridge. So with the Moderna, it's not as cold as the Pfizer, but I think Pfizer is now studying it where they might not have to do the -70 and can use a lower temperature like the Moderna. So I think that's mainly it. With the Moderna vaccine, each of the companies studied it slightly differently. The Moderna was 2 shots 4 weeks apart, and Pfizer was 2 shots 3 weeks apart. And I think they both started studying it at the same time, but I think Pfizer got, because of the 3 week apart, had their data in a little sooner to the FDA. And I think it was just like a week or 2 later, the Moderna presented their data. So again, these vaccines have been incredibly safe and successful as we've seen just from the numbers and the drop of cases of COVID. I don't know if Ralph, do you want to add anything to that?
I'm sorry, we can't hear you, Ralph. It's not muted.
Yeah, Ralph, I think your microphone went out.
Okay, yeah. I'll echo what Dr. McLeod said. It is an amazing technology where a fragile chemical such as mRNA is able to be loaded into, like, as you said, a fatty-like lipid particle injected into our muscle, and that migrates and finds its, the cells in our body, the immune surveillance cells, are able to recognize this particle, engulf it, and this particle migrates its way into the cytoplasm, as you said. And our own cellular machinery in our cells takes that template of mRNA and makes that protein that it's programmed for, the spike protein. And then that spike protein migrates back to the cell surface, and that's where other types of immune cells in our body recognize that and start to produce antibodies to it. So really an amazing technology. It's astounding.
Yeah, it's fascinating how scientists have basically used a part of the coronavirus against itself. So it's very, and in the short time that it took for them to make it, within a year, it's an incredible feat of scientific innovation. So it's truly fascinating to me. And it almost feels like you have to relearn biology and some bit of chemistry in order to understand it. But luckily, the FDA does provide some very useful fact sheets for those of us who are not experts in this field of epidemiology. So with regards to that, I do want to state with Dr. McLeod, yes, it seems like Moderna and Pfizer especially have been like neck to neck almost in terms of like being authorized and being eligible for, different the age groups. And yeah, but within Pfizer's case, I feel like in the beginning of the pandemic, there was issues with it having to be stored at extremely cold temperatures. There was just a lot more required for it to be shipped to places, hence why during the beginning of this year, it was kind of hard to even get access to it for some states. So in that case, is there really any difference for those people who get either the Pfizer or Moderna? Because there has been some speculation regarding which is better to get, but I don't think there really is a better one, is there?
I agree with you, Veronica. In my opinion, anyway, I think in terms of the technology utilized and the efficacy of the vaccine, that they're quite similar. Yes, the storage is different. The age approval is younger with Pfizer, but I'm quite certain that Moderna is either has the data already or is working on it. There's no reason to think that their vaccine would not be safe and effective in the younger age group. Yes, the timing of the two shots is shorter with Pfizer, but my opinion, for all intents and purposes, they're extremely similar.
And I'm sure Dr. McLeod can agree with that.
Yes, I agree with it. I know some people ask, well, if you get one, can you do the other? But most of the studies have been done just with the one product. I think there's a small study in England where they're looking at, exchanging, giving one dose and giving Pfizer first, and then either they have the AstraZeneca, they are that second, and changing up. But that really hasn't been well studied. So usually it's recommended. I think most vaccine sites have been very good about making sure when you come in, you know which one you get, and then you come back 3 weeks for the Pfizer or 4 weeks for the Moderna.
Mm-hmm. As someone who also got the vaccine myself, the people at the clinics are very good at, keeping track for you and scheduling when your second dose is, so you don't even have to think about it. So that's very appreciative of that. Last but not least, we have the kind of middle child of the two in terms of its type and how it's distributed and dosage. We have Johnson & Johnson, also known as Janssen. I'm not sure what the difference is between that and a non-replicating viral vector vaccine. Perhaps you guys can take it away once again and just describe briefly what that actually means.
Well, it's an adenovirus vector, so it's not contagious. It's similar to the AstraZeneca, which is available in Europe and was developed in the UK and is, I think, widely used there. This J&J Janssen is a single shot, which is a big difference from the Pfizer and the Moderna. It does not have the mRNA. It's not a live virus. It's a fragment of the spike protein included into the adenovirus vector. And again, it was studied later than the Pfizer and the Moderna, so some people see 72% effective, but one of the thoughts is that it was being tested against strains such as the UK strain that is more contagious and more generally leads to more sick patients. So it does work just as well at preventing hospitalizations, and in the studies there were, it prevented death, which is the important thing. They did do studies in South Africa where there's an aggressive strain. It was found to be quite effective. So I think I've heard one expert say, somebody said, what is the best vaccine to get? And the answer a month or two ago when there was a shortage was whichever one you can, because they all work so well. So I still think, now it might come down to somebody's convenience. Like if they're homebound, it's definitely easier to give the Johnson & Johnson the one shot rather than try to arrange the two shots of the mRNA vaccines. Ralph, I don't know if you wanted to add anything to that.
Yeah, sure. No, I would just add that I personally, for myself, my family, friends, now it is much easier to get the have accessibility to the vaccines, but I still I had been and will still tell my patients just whatever vaccine is available, I have confidence in the safety and efficacy of all of them. We can go in, the Johnson J&J vaccine did have a potential issue with clotting in younger women, but that is exceedingly low incidence, and so I wouldn't really. There's really no absolute contraindications to getting any of these vaccines other than a history of a very severe allergic reaction. So very effective, safe, and yes, it is one and done, which makes it compliance, I think, is a lot easier with a one-shot vaccine, and the storage is also easier. So they each have certain unique attributes, but for all intents and purposes, they're all great vaccines.
I'm glad we have your approvals, that's for sure. And just with the other two, I've also provided clickable links to the fact sheets for each one of them. And I did not mention this at the beginning of the webinar, but I did send a handout to everybody that registered. And if you have that handout with you as you follow along with us, you can click on all of the links on that PDF and you'll be able to access all of the links that are up on each screen. So just in case you didn't know that, you are able to do that. And now we're just gonna go back to me. Feel free to jump in whenever you like, but I wanted to show some examples of how vaccine misinformation can look like and how common it is to see online as a result. I'm gonna go with the standard definition of what misinformation is, which is the incorrect or misleading information inadvertently shared to influence public opinion or obscure the truth. And the first one that I will start with is just general conspiracy theory. And that I cannot think of a better example than the pandemic video that was spread around by Dr. Judy Mikovits, although doctor is not currently what she goes by, as she's been thoroughly debunked and she's only a former researcher. So I don't even think that the term doctor should apply to her personally, but during the pandemic, she was known to spread a viral video that was very viral online and on social media called Plandemic, where she was spreading misinformation about the origin of the coronavirus. And she is also in that same video has tried to spread falsified information about the vaccines where that they might actually, kill most of the population, which is completely untrue. Hence why that video has since been taken down from the internet, thankfully. And for those who would like to know more about her and who may be spreading this and not knowing more about her, there is a great article that was written about her, because the reason I wanted to show this, because just because somebody has doctor in front of their name does not necessarily mean that they are the best source of information. I highly urge anyone who shares information like this to look up who is sharing this information, who is behind it. And just because they have doctor in front of their name does not necessarily mean that they know what they are talking about or are spreading the right information. You will see in that article, Fake Science, is that she's had a legacy of spreading false information. She actually falsified and was arrested for falsifying documents regarding a study that she did on the XMRV and chronic fatigue syndrome. So she has been debunked in the past, and she hopefully will be continued to be debunked in the present. And that is an example of one conspiracy theory that has hopefully not survived in this current year, but was very, very big last year. Next, we have a different subset of misinformation, which is misleading headlines that may have been visible throughout this year and last year. For instance, some of you may have seen this New York Post headline, 23 die in Norway after receiving the Pfizer COVID-19 vaccine. Now, obviously, somebody looking at that headline may be very cautious about getting any vaccine after seeing something like that, because that headline, intentionally or no, does make that correlation between death and the vaccine. But as you'll see in the Reuters fact-checked website, they clearly were not providing the full context. As it was discussed later, these were the 23 that died in Norway. They were part of an elderly home. They had underlying conditions. So when they received the vaccine, it was not from the vaccine that they died. It was probably from other conditions and just from old age. So that misleading headline was not providing that context and was therefore leading people to an undeserved and false conclusion about the vaccine. Another case that occurred earlier this year in the news, this headline was very common. A 78-year-old woman in California vaccination site dies after being inoculated. Again, it's the same thing as with the Norway headline, that they're falsely equating vaccine to death, and which is not true. And that's why after the fact, a few days later, they actually had to correct that headline and retract that headline entirely to California woman 78 dies after vaccination, though no sign of link. However, if many people share this particular headline first, that's what's going to be in everybody's mind. So it's unfortunate that you do have to look out for, new headlines later on. You cannot take something at first value when it says something like that, because as I'm sure the doctors here will tell us and agree, there has been very little deaths associated with the vaccines. The vaccines do not cause death. And in fact, it is getting the vaccine that is decreasing the deaths in the United States. So these kind of misleading headlines are one of the worst types of misinformation out there that you got to watch out for. And oh, I'm sorry, go ahead.
May I just add something?
I'm sorry, what were you saying?
Yes, may I add comment?
Oh, of course, jump in at any time.
Look, everyone has entitled to their opinions and whether or not they want to receive the vaccine, but there are many people will still refer to these anecdotal headlines and stories and use them as reasons not to to receive the vaccine. Now, whether or not they really believe this or not, or it's they're looking for a reason not to be vaccinated. But even not only scientists and newsworthy people, probably colleagues and friends have had their own stories, and they may or may not be referring to stories such as this. So it is important to discern which information is correct. Your point is well taken.
Thank you. And I guess now that I mentioned too that there's always gonna be more of a high percentage of people simply sharing this headline and not really reading what's in it, which is how people miss some of the context that might be involved with it. The headline should always be corrected, but if the article itself does not contain any links to any of the studies that corroborate that headline, then it should definitely not be trusted as well. So that is why it's important to emphasize that people should, when looking up news of the vaccine on their own, not to just read the headlines, to always look through the article that it's writing in and to look for any credentials and links to verifiable resources within it. So thank you for sharing that though, Dr. Cipriani. Anything to add, Dr. McLeod?
Well, only say that the reports on the side effects, I think you always have to remember what COVID can do as far as symptomatology. First of all, we know people die from, I think it's over 590,000 Americans. There then also is what's known as post-COVID syndrome. And I think, they say it ranges anywhere from 5 to 80% of people who have COVID come down with fatigue and other symptoms that persist for months and months. Again, being a relatively new virus in the last year and a half, we don't really know what's causing that and what any treatment is for that. That's being studied. So I always tell patients, if you get the vaccine and you have, we'll talk about side effects, I think a little later, 1 or 2 days of fatigue, it's nothing compared to actually getting COVID and then not being well for months and months and months. So I think we always have to put that into perspective when we talk about side effects from the vaccine.
This is very important, Dr. McLeod. And it's, yeah, like I'm just echoing what you said. It is super important and it's way better to just be sick to feel a little bit fluish for the 2 days or less than to incur those long-term effects or even be hospitalized and die from it. So, and then the last example of vaccine misinformation that I've been seeing lately, or most often, is through social media platforms. For instance, we have yet another self-described doctor on Twitter who is spreading the well-known theory at this point that there is some kind of technology in a vaccine that acts as an operating system in the human body. Sounds ridiculous, but the fact that there's someone with the doctor in front of their name saying this will lead some people to actually believe it. So this type of social media post is something to watch out for, even if the person has a doctor in front of their name. And for those who are familiar with the social media platform TikTok, there was actually a trend on it where people were putting magnets on their arms where they were inoculated and claiming that it was staying on there because the vaccine that they just got had a lot of iron in it and was therefore letting the magnet stay on there.
Veronica, it's funny though how things can stick. I mean, that
pun intended.
The CDC actually has it on their website that it does not cause you to be magnetic. So these misinformation, this misinformation does get out there, and it's a shame. But yeah, I mean, it's enough that the CDC actually had to specify that it does not do that on their website.
It just shows how incredibly widespread that misinformation can get, that the fact that the CDC has to comment on it. And I realized that it might have started as just a joke on that social media platform, but anybody out there can take that as fact if that's what they want to believe, and unfortunately that'll spread to other people that agree with them. So that's the unfortunate thing, that right now, even if you want to find some levity in their situation, it's important to just keep the facts where they are and not distort them in this way. As funny as it might be to some people, it's important to keep the facts where they are.
Yeah,
and
there was even a mention that it might be dangerous to get an MRI if you've had a vaccine, because yes, it's funny how things just
get out of hand.
catapult.
Yeah, it's unfortunate, but true. And for those of you who want to learn more about how frequent these social media platforms are specifically designed to create that kind of engagement through misinformation, I have this Bloomberg article, talks about Facebook. And then we also have a study done by Bloomberg Journal about social media and how much it's contributed to vaccine hesitancy. For those who are interested to learn more, you can definitely check out those links in your own time. So before I conclude my portion, I just wanted to go ahead and give you a really useful tool that I use when evaluating health information online. It is known as the CRAAP method, where you basically evaluate sources through currency, R for relevancy, A for authority, accuracy, and purpose. You take any article or news source that you find online, go through all the stages of CRAAP, and you'll be able to see whether it is CRAAP or not. And while going over different sources for learning how to evaluate specifically COVID vaccine information, I found that there are certain red flags that you have to watch out for. First one is if an article or a study has no obvious author or not even an about page, that's a red flag. If the author presented in the article or study has no valid credentials, or within the case with Judy Mitovich, if you just simply Google her name, you'll see that she's been thoroughly debunked before. That's also a red flag. If the author or organization appears to have a conflict of interest or is one-sided, that's also a red flag. Always pay attention to an article or study's date at the very top, because if it has not been updated with the latest news or evidence, that's a red flag. If there's no scientific evidence listed, such as in an article or a news headline that says, deaths are associated with the vaccine, but if there's no actual source saying that, then that's a red flag. And lastly, with any social media post or forum that tries to tell you that the vaccines aren't safe, but it's full of spelling errors, that's also considered a red flag. And I think it's helpful for a lot of people when they search online to just remember that these website endings of .org, .gov, and .edu are the most reliable, will also be a clue for what is most reliable, because .org refers to nonprofit groups such as the Mayo Clinic, .gov refers to any government websites such as the CDC or the FDA. And then last but not least, we have .edu, which is any source affiliated with a university or academic institution. So if there's health information on something like Harvard Medical University or from Johns Hopkins Medical University, that's something that is reliable and accurate. That's going to have reliable and accurate information. With .com, that's where you have to be kind of careful, because .com refers to anything that is meant to be a commercial website. And there have been a lot of COVID scams as of late with websites associated with that last mark. This link will lead you to a page regarding a lawsuit currently going on with a website that claimed to be selling Moderna vaccines. And the website's name was modernax.com. So just seeing that .com should already have been a red flag to some people, but unfortunately some people did get scammed out of their money trying to get vaccinations online, probably at a time when they weren't as available in their state. And unfortunately, I'm glad that they were caught, but it's something that needs that more awareness about how to spot these kind of things to begin with will prevent it from happening in the future. So that's why I put a red flag there as well. So for more information on how to evaluate health information online, my website, the Dr. Stephen Mickley Community Health Resource section, has a lot of other great resources that you can check out. We have a whole page set up just on online health resources for you to consider the following questions. Who is the author? what information is being provided, when the information is written, and why it was this site created. We have a link to the CRAAP test right here, and a bunch of other ways to be able to evaluate resources. So take a look at this when you on your own time, and hopefully that'll help you research. You're making your research a lot easier and more productive. And for those of you who might be thinking, oh, how am I going to find these resources? When am I gonna have the time to fact check all these things? I'm a busy person. I don't have time to be on the internet all day, making sure that the articles that I read aren't accurate. Luckily, there are these sources right here. I think I need to restart the program. Hold on. I'm sorry about that. My PowerPoint just stopped working. Give me just 1 second. I got to bring that up again. Sorry about that. Technical difficulties. Okay. I just put this up to full screen. I apologize. Okay. All right. Now it's up again. Okay, so as I was saying, if you do not have time to fact check articles or headlines that you see online, luckily there are resources that are already available that do that specifically work to fact check for you. So this is a list of those that were very relevant during the election, the most recent one, to fact check what our former president was saying. But I have made a handy list of those same resources that are specifically dedicated to fact checking information on coronavirus and the COVID-19 vaccines that are out on the internet. So definitely take a look at those when you have a chance, or whenever you come across something that you might think is misleading or misinformation, use one of these websites and see if they've already debunked it or verified it as fact. And last but not least, no matter what news source you get your vaccine information from, whether it be by Googling or through social media, make sure that whatever article you're reading that disseminates information on the vaccines or any new updates, that they come from these reliable sources: the Center for Disease Control and Prevention and the FDA, US Food and Drug Administration. For everybody who is more local, such as in Connecticut or in Greenwich, the COVID-19 vaccine portal will primarily tell you about state guidelines and help you find a vaccine center in your area. And our very own Greenwich Hospital has its own very helpful Facebook, page on just vaccine information. I'll just quickly show you what it says right here. So not only does it have appointment information and frequently asked questions, they also have just a general about the vaccine page, and even a section for vulnerable populations, such as kids, seniors, and the like. So do either of you doctors have any other resources that you'd recommend to your patients, or are these really the top 4?
I think those are the top 4. You know, and the any state government, you know, of course, has their own site. So if you happen to be in New York or Florida, you know, it is helpful to get the local information. I think the town of Greenwich also has a site. Is that correct?
Yeah, they do. The town of Greenwich specifically. They most often link to either the CDC or the ct.gov site. So
yeah, that makes sense.
Yeah, so that if the town of Greenwich is the website you go to, then at least you know that they have reliable information because they take it from the CDC or ct.gov.
Right.
So that is good. Anything to add, Dr. McLeod?
No, I think as you mentioned before, the New York Times website for up-to-date information on vaccines. The NIH.gov is a good website. I know some patients ask me sometimes about supplements and other non-medical treatments, and they have a site where you can look up any of that as far as like you know, vitamins or supplements being treated not just for COVID but for other conditions, and we'll list like any benefit or side effects of those. So I sometimes recommend that to patients too.
Okay, well, you guys heard it here. In addition to that, we have these 4, so plenty to choose from. So, but not too many. Okay, so now we're coming up on the part of the webinar where it's up to the audience to ask whatever questions that you may have for our experts, Dr. McLeod and Dr. Cipriani. So I'm glad to see that the attendees that we started with are still here. Thank you so much for sticking with us. And this is all your time to shine, basically. If you go into the Zoom bar, you will see a Q&A tab down here. Click that and you can type in any question that you'd like to ask our experts here, and they will be happy to answer. We have 5 minutes left till the end of the hour. We can go over a little bit if the experts are all right with that, but if there are any questions, please feel free to write them in right now. And I'm just gonna have to restart the program again, just 1 second. We got one question already. So the first question is, twice vaccinated person, can they go to the restaurant or church without a mask on? What do you doctors think?
Yes.
Yeah, the CDC has come out and said that it is, if you're vaccinated now, it is safe to go out in public and not wear a mask. It's for the unvaccinated people that it's still recommended to wear a mask. The only exception I think they're pointing out is somebody who's immunocompromised. If somebody's getting chemotherapy or has had transplants, they still recommend, even though they've gotten the vaccine, that they be careful and still wear a mask. I think that's the information I would say. Ralph, do you want to add anything?
Yeah, no, that's it. That's exactly correct. I mean, I think as long as you're more than 2 weeks out from your vaccine series or the 1 shot of J&J, then you're, it's not a guarantee that you won't get infected, but the symptoms will be much less, and mortality is reduced markedly. So yes, the answer is yes, other than the immunocompromised, or if you're pregnant, I believe also.
We have another question. Can we join church singing without a mask? I think that question can also be answered similar to how the first one is. And let me just clarify. I did say you can ask any question, but tonight's webinar is specifically about the vaccines. So if there are any questions regarding the vaccines, we have 2 experts, 2 infectious disease specialists who can answer the vaccine questions. Masks is pretty outside of that. So, but yeah, please look to CDC guidance on that. That has not changed. So I think they pretty much answered that already. The guidance has not changed with regard to masks wearing. Oh, so you meant vaccinated person. Okay. Yeah, so I guess what he meant to say was if you are vaccinated, can you go to church and sing, for example? Any response to that?
Yeah, I would say a vaccinated person can go to church and sing. Again, the exception would be, I guess, if you're feeling sick or ill at the time. Again, the vaccines are so effective, but it's not 100%. So that's why I think if somebody is ill, not just with this time of COVID, but they should not probably be in a group, and singing I would say would not be advised.
Mm-hmm.
Yeah, I totally concur.
Okay. Next question we have is, what should we know about booster shots? I guess they mean, would there be anything supplementary that we have to get after we get our full doses?
Remains to be seen. I think initially it was almost, we were thinking it was a given that boosters would be required, whether it be annually or less than that or more than that. It does seem to be, though, that given the robust nature of the immune response, that unless more insidious variants arise, that the vaccine may actually last longer than we originally suspected. That would be certainly welcomed, but we don't know yet.
Yeah, I think that's just, it's a hard question to answer because there just isn't anything.
But
we
it's,
know.
you know, it's a great question. We'd love to know the answer, and time will tell.
Exactly. Dr. McLeod?
Yes, I agree. I wouldn't be surprised if at some point we need a booster, almost like with the flu vaccine. Every year there's, you get the flu vaccine just because there are different strains. I think we all heard about strains around the world, including, recently in India and Vietnam. So generally speaking, right now, the vaccine is effective against these variant strains, but there is always a possibility a new strain could evolve in other parts of the world where they're not getting vaccines. So I think that I wouldn't be surprised if a booster will be needed. I know Pfizer sort of had a press release a month or so ago that they expect to have a booster, but I think that might have been to raise their stock or whatever. But I think, hearing like Dr. Fauci speak, he says the data needs to come in. Again, the vaccines have been out less than a year, and we have to study just the immune response and then see also what's happening with these strains and what's happening in the United States as far as number of cases. So.
Okay, I think that was as good as an explanation as we're gonna get, considering we don't have that much information yet. We have another question regarding them. This is regarding travel. Can I go to England this October with 2 vaccination completed? This is the type of question that would be answered with this Connecticut government portal, vaccine portal section, because they have a specific section just on travel advisory. But do you both have anything to add to that? I have not checked specifically if anybody can go to, travel outside the United States yet.
The CDC has a good site, cdc.gov/travel, and they've started updating it as far as each country's requirements. They also have a risk level for each country. Level 4 is high risk, and they don't advise traveling. They also, of course, give advice, as for people who are vaccinated versus non-vaccinated. I think most countries, they do recommend that you get, COVID swab before returning to the United States. And I think they do advise, although it's not required, that you get a swab 3 to 5 days later. But I think that site I've noticed is very good. Again, it's cdc.gov/travel. I haven't looked up England, but other countries I've looked up, they actually give you the risk level at that time. And I think, again, if it's in October, you can check on it later in the summer and find out what they're recommending. And it includes, I think, what the country requires if you're going there as well.
Yeah, that's important because I think you need to, it's critical to know which countries require which, whether proof of vaccination or a PCR swab before you travel. So it is important to check that site.
Okay, yeah, because from my understanding, I only know off the top of my head that Japan is probably level 4, so you definitely can't travel there. I don't know specifically what other countries' statuses are, but just like Dr. McLeod said, CDC's travel advisory page would be the place to go for those kind of specifics. Some people are saying that their vaccination expires in a certain time of this year. Although I'm not familiar, do the vaccines do not expire? Am I correct, or do they just no?
Is that misinformation? I don't.
Yeah.
So
So
I think the CDC was saying at first, like after someone was vaccinated, they didn't know how long it would last. So at first,
yeah, there's that
3
aspect,
months, and now they're up to 6 months. But I wouldn't be surprised if they extend that. So I think as more information comes in on people who've gotten vaccinated, it will probably be extended. So I think maybe that's what the question refers to.
possibly, yeah, because I'm not aware of any vaccine that expires, especially.
No, I think you're
like
right,
a month.
Gavin. That's
So, but what's important to visit the vaccine portal from the Connecticut Department of Health is that they specifically say that they're not as restrictive as they were earlier, where you had to get tested prior to traveling within the United States. They're not as restrictive anymore. You don't, for certain states, you might have to provide proof that you're not testing positive, but in Connecticut, it's not as strict anymore if you're traveling domestically,
Right.
from what I just checked recently. So
Yep, that's correct.
as long as you have proof of vaccination or proof of testing negative for certain states, you should be fine traveling domestically. And I think most people would advise that you should probably travel domestically as of now anyway, so. Okay, so this one of the registrants is saying that their New York State registration clearly mentioned that they expire in August. I'm not certain what guidelines are specific to New York. Do you have any comment on that, either of you?
I am not aware of any official expiration date on vaccines. I could be wrong, but I'm fairly confident that there's not. I'd love to see that, but not that I'm aware of.
Yeah, I think that's something that has to be spoken with their healthcare provider, whoever asked that question. So I would try to talk to a healthcare provider or somebody, or there is a helpline on the New York State website actually that you can actually contact and actually ask about that. So that's primarily why I would ask that question if I was in your situation. So I hope that helps. Okay, so again, we have another question. What is your expectation that we'll be taking booster shots a year from now, 5 years from now? Because vaccines either wear off or because new variants are resistant to the vaccine. So I guess you can kind of reiterate what you mentioned earlier, is that I guess it really depends on how long these variants are around. But
Right.
would herd immunity be able to combat that, or no? Would we have to develop new percentages of immunity against these variants every single time?
I think the variants are key. Variants are not always resistant to vaccines, but as more selective pressure is put on these viruses, just based on natural selection, yes, the more variants, the more likely that they will escape vaccine, similar to influenza and many other viruses.
Speaking of influenza, so these booster shots would sort of act as the influenza vaccine every single year that we take. Do you foresee that occurring, like in addition to the flu vaccine that we take every year mandatorily for the hospital, for instance? Do you see us having a mandatory COVID-19 booster shot every year?
Well, I think if you asked me this question several months ago, I would certainly say yes, unequivocally. It may still be the case. I'm starting to get, this is my own opinion, that it may not be necessary, but certainly possible. It would not, it's in the real realm of possibilities.
Yeah,
Do you agree, Dr. McLeod?
I know the Yale Health System, I think, has made it mandatory for volunteers. So it'll be interesting if they'll do that for employees. Again, I think, as we mentioned, it's an emergency use authorization. I think Moderna has gone for get full FDA approval, which might take a few months. And then I could see possibly that it might be mandatory then, unless there's some special exemption. So I think we'll see over the next few months both what happens with the epidemic and then as the vaccines get formal FDA approval.
All right.
To get back to the other question, I just quickly checked on the New York site. Perhaps that was referring to that Excelsior Pass. I know that has a 1-year expiration on it, where you can try. That may be the case, but again, I'm just a quick look I did.
Now that they made another question, perhaps they were referring to registering for a vaccine, like making an appointment, as opposed to like the vaccine it's expired.
Oh, that's very
so I think I
possible.
may have just, okay, so now they're saying that it's something involving 6 months, that after a specific dose, that their vaccine expires exactly 6 months after their second dose. That's the information that they're telling us now. I'm not as familiar with New York State vaccine registration. I would check out that helpline that's on the New York State website and ask somebody there. I know sometimes they'll put you on hold. I know that they're not very open to answering as quickly as you might like, but I think somebody there will be more likely to help you than us tonight, because I myself am more familiar with Connecticut registration personally. But I apologize for not being able to help you. And I thank you, Dr. Cipriani, for checking. I did hear about that Excelsior pass also. And I'm wondering how many people are going to sign up for that. Hopefully enough, but who knows? Anybody else with questions? We are 10 minutes over the hour. If anybody has any other questions, I think I do have a few of my own that I can ask, or do you think that's enough for tonight? What do you gentlemen think?
I'm fine.
You're fine with me answering more questions?
Sure.
Okay, so I'm just gonna, if nobody has any other questions, I'm just gonna ask, because I have a few up here that I prepared with this PowerPoint. So I did have somebody who is maybe a part of the audience tonight. The question specifically they wanted me to ask is if I have any underlying health conditions, should I get the vaccine? So I'm sure you've had patients come in and ask you this. And I know a lot of people I'm familiar with are curious about that too. So what would you usually say to a patient who may come in asking that specific question?
All the more reason to be vaccinated.
Oops,
You're
sorry.
more vulnerable to severe possible effects of COVID infection. So it behooves someone with an underlying health condition to be vaccinated, as I see it.
Do you agree, Dr. McLeod?
Yes, I agree. I think most everyone should get it. I think some patients might be getting immunosuppressant therapy. So sometimes they might want to talk to their treating physician, whether it be an oncologist or a rheumatologist. And sometimes they recommend doing it at a certain time frame, like when they either a month after they got some medication that would weaken the immune system. So if there's
that's a good point. I mean, it may, well, I don't want to open up a can here, but whether or not it has the same, you know, there were patients with underlying conditions included in the trials, but I don't think we know enough about, you know, the robustness of the immune response in all patients yet.
Yeah,
Yeah.
No, I think they should get it. It just might depending on the timing of it. If they're on a course
Right.
of
That's a very
steroid,
good
say,
point.
and wait till you're off the steroids.
Sure.
To get it.
Sure.
So if that's the case, but most patients, again, there are certain health conditions which make COVID much more severe, including obesity, diabetes, being older. So anybody in those risk factors definitely should get it, I think. And if there's a condition that they're worried they shouldn't get it, they could always, I would say, check with their doctor.
So just to clarify, there is no really underlying health condition that should prevent you from getting the vaccine. It's really the underlying conditions that would make getting COVID more severe, which is why, you know, getting the vaccine should be encouraged, even if you do have an underlying condition. I think as long as you get the approval of your healthcare provider and make sure that it's not going to interact badly with any medications you may be on. But the general answer is yes, you should get the vaccine no matter what, correct?
Correct.
Okay,
Right.
great. So that's an easy answer. So what about this one? If I already had COVID-19, should I get the vaccine? Because some people might think, oh, I'm already immune, I already have the antibodies. How would getting a vaccine help in that regard if you already had it?
Well, the answer is yes, and the timing, the current recommendations call to receive the vaccine as soon as you would be released from quarantine. That could be debated, I would assume, but that's what the current guidelines dictate. And why is that? Well, you have a degree of immunity, but the level of response after vaccination is tremendous, and it will certainly augment the immune response that's generated from natural infection. There is some talk, and this is not to be taken as truth at this point, that perhaps one booster, one vaccine after COVID infection is sufficient. But as of now, it's still the whether it's the 2-dose Pfizer or Moderna or the 1-dose J&J, that's still the standard of care now.
Dr. McLeod, anything to add?
I would just say I'm aware of like 2 patients who actually had COVID a year ago in March and April, that first surge, and then got it again this year. So, you definitely can get COVID more than once. I think as far as the timing, again, as Ralph said, the CDC says you can do it once you're off quarantine. Some people, I think, say you could wait up to 3 months because the natural immunity, and they were saying that especially when there was a shortage of vaccine 3 to 4 months ago.
Right.
I think now that vaccine is so readily available here in Connecticut, it's no longer so much of a issue.
I agree, Gavin. Yes, that's right.
It's definitely not as much of a hassle, which is unfortunate considering the hesitancy has increased, but the demand has also increased. So I'm glad that this, even if people can't use that excuse just because you had COVID, you shouldn't get the vaccine. No, it's clear that it happens more than once to you, and I think also it just reduces the transmission rate if everybody's just vaccinated anyway. So you're not only protecting yourself, but you're protecting everybody around you. And that's what we should be going for. How about one last question off of here? How about, is there a specific range of how long does protection from COVID-19 vaccine last? Is there any evidence or data regarding that?
That's what the questioner was asking about, the expiration.
That's why I wanted to ask, because maybe
think
that'll shed some light for this audience member.
Yeah, so again, I remember, I think it was just fully FDA approved in November, December. They were testing it a few months earlier, but that's why I think the CDC has come up with that 6 months right now, because it's roughly 6 months since it got approved. But I think at first they were saying 3 months, then they extended it to 6 months. And I think as more data comes in, it most likely will be extended. So I think it's a moving target. So I think they'll probably say soon that it's up to 9 months or a year as they get more data. And that also goes back to the question on the booster. I think as they get more information on that, they'll be making recommendations later in the year. So again, these are, it's a new virus, it's a new vaccine, and we're learning more each and every month.
Now, I have one thing to add on the previous question. If you've had COVID, should I get the vaccine? There's a practical aspect too. Many times, at certain events, and if you want to attend or travel, it may be the case where you need to show proof of vaccination. So just having COVID doesn't cut it. So it's a practical aspect too. It opens up many doors for you.
Well said. I'm glad you made that point, that extra point. So last but not least, I think it would behoove the whole audience here to know, just to reiterate, what are the expected side effects of these vaccines? Because I think part of the reason most people don't want to get it is because they're afraid of getting sick or having to take off work after getting them. So let's just go over what is expected from these vaccines and when you get them.
I would just say the most common thing is a sore arm, pain in the arm, some redness at the site. Again, usually that's short-lived. Some people get systemic symptoms, feeling like achy, flu-like, can have a fever, be tired, be nauseous. Typically, it's more common in the mRNA vaccines after the second dose. So I think some people, it might pay to, plan to take it on a day when you have the next day off. I know there was a doctor's office here in Greenwich where they wanted all their employees to get it, and as a perk, they gave them the day after they got the second vaccine, they got a free day off that they were being paid, and they say they got 100% uptake in their employees by doing it that way, which I thought was pretty nice.
We should have done that. Yes.
Yes, and again, we see this with other vaccines too. I mean, I think it's the same side effects that happened with the shingles vaccine. People report that tetanus vaccine, there's a similar side effect. So it's not anything unusual. I think we mentioned anaphylaxis earlier. The CDC through the MMWR did an analysis, I think, of the first 90 cases of anaphylaxis, and what they found, I think, 80 to 90% of them were more, people fainting or having anxiety attacks after getting the vaccine. So it wasn't really true anaphylaxis. So it was really a very small number. So, I mean, I think anytime somebody's in the hospital, when there's blood being drawn, you can pass out, or even from other vaccines that happens. What's good is that at any vaccine site, they make you wait for 15 minutes after the vaccine, just so you're observed. If you have a history of anaphylaxis, you wait 30 minutes. So I think all the precautions are in place at the vaccine sites. So again, I would just strongly encourage anyone to get it.
Gavin, I have a question for you. Have you seen that people who've had COVID have more of a reaction to the vaccine?
That's a good question.
I think it's anecdotal. I mean, what's also interesting, we were talking about long COVID or the post-COVID syndrome before, right. And there are reports that up to a third of people with that get better after they get the vaccine. There's something that the immune system might be stimulated.
Well, that's very
so I've heard it both ways, where people have had COVID got, sicker, but then I've also heard that, in some of the studies of people with long COVID, they actually feel better after they get the vaccine.
That's a great point. All right,
Yeah.
We'll see if that pans out. Yeah.
I hope so as well. With regards to side effects, we did not get to this question, but that kind of transitions well into for people who do not know what VAERS is, that is the Vaccine Adverse Event Reporting System. So that's where healthcare professionals, clinics, even patients or community members who've gotten the vaccines, they can report adverse events or side effects that are not expected, such as, allergic reactions, the blood clotting, the myocarditis that is being seen as a pattern. So anybody can report if they've had a side effects that's more critical than just, the flu-like symptoms that you might feel after a day or so. If there is anything worse than that you might feel after getting a vaccine, you can report it to this Vaccine Adverse Event Reporting System. And if I click here, I can just briefly show you what that website looks like. It tells you it's from the CDC, so it tells you all the information about how to report it and how exactly it's reviewed. So whenever you see a headline about a certain pattern emerging from vaccination, that's primarily from this reporting system. So I just thought it would be important to mention that before we concluded. Anything to add regarding that?
No, and that's for any vaccine, right?
Yeah, not just for COVID-19. Right. Yeah, I should have specified that. That's like the nationwide any vaccine reporting system.
Right. Thank you.
All right. So thank you for attending. I think that's where we'll conclude for the night. For those of you who have stuck around, thank you so much. I know we've gone over our hour and I apologize, but feel free to register for more free and upcoming webinars at the greenwichhospital.org/events page. My next medical library webinar will be this time, actually 1 hour earlier, next Thursday. It's going to be Food for 50. We also have a link here for the hospital newsletter. So if you'd rather receive these webinars over the emails, you can just subscribe here and you'll be able to know about upcoming events that way. I have a very large archive of previous webinars I've done in the past year. So I will be posting a recording of this webinar. If you have a family member or friends who weren't able to make it tonight, I will be posting it on my website here in this particular page for webinar recording. And feel free to look up any of the other webinars I've done in the past year. The Better Sleep Resources on Insomnia, that was a very popular one. For those of you who may have missed it, it's right here. It's for you to look at the recording for. And we have the contact information for myself and Dr. McLeod and Dr. Cipriani. You both are taking patients, I assume, right? You are able to get new patients if they're requested you.
Yes.
Yeah,
Yes.
so they are available to take on new patients if you give them a call. So their numbers are right here for you to see. So if there are no more questions, I think we will conclude for the evening. Again, thank you so much, Dr. McLeod and Dr. Cipriani, for your time.
You're welcome. My
And
pleasure.
I'm sure all the audience members also appreciate. Yep, I'm getting comments here saying thank you from the audience. And I appreciate all this expertise, and hopefully things will just keep looking up in the next few months. And you know, I'm just grateful that there's vaccines at all.
Yes.
So
Thanks for having us.
Yeah,
Yeah,
thank
of
you. Thank you,
course.
Veronica.
Yep, and good night, everybody in the interwebs.
Good night.
Good night.